All right. Hi, everyone. Welcome to the Fringe podcast. I'm Dr. Genevieve Newton. I am the scientific director at Fringe, and I'm here today speaking to Dr. Anna Cabeca. Very excited to have you as our special guest. So Dr. Cabeca is the best-selling author of the book, The Hormone Fix and Keto-Green 16 and Menopause. She is a triple board certified and fellow of gynecology and obstetrics, integrative medicine, anti-aging, regenerative medicine. That's an amazing list of specialties that you have there, Anna. She holds special certifications in functional medicine, sexual health, and bioidentical hormone replacement therapy. So Dr. Anna is also known as the girlfriend doctor and hosts the podcast by the same name, which is where we spoke about a year ago. So thank you for coming and joining us on our podcast today, where we're going to, I guess, kind of pick up our conversation with sort of where we left off and talk a lot about menopause with a little bit of a focus on red light therapy, but more so just kind of bigger picture. Want to hear more your thoughts on a variety of different topics. Starting with, for listeners who haven't come across your work before, tell us how you got here, because you started off as more of a conventional OB-GYN, and then you shifted into this functional integrative side. So how did that process happen for you?
Yeah, well, I was well positioned to. Well, first of all, I grew up in a culture first generation American, so a lot of food as medicine. So, and a lot of health problems on my side of the family, as with many times first generation or with immigrants. And so, thinking, okay, paying attention to this, paying attention to women's health. And then I went to an osteopathic medical school. So I learned about, I mean, I was really driven. I chose osteopathic medicine because of the philosophy of empower the body to heal itself, right? Alignment, address the issues. The fascia is connected to everything. Can't treat one part of the body without treating the rest. And so I had that going in. And then I did residency at Emory University, one of the best allopathic institutions, I'd say, in the nation, and especially for OB-GYN. And I would always say, okay, what can I do based on my osteopathic training that, isn't part of the curriculum for our allopathic OB-GYNs? And so addressing, of course, function and the neuromuscular system, and when do we need nutrition consults, and when do we need movement and physical therapy, these additional things that, especially in hospital-based practices and clinics, of course, we had, you know, we had some long-termers, whether it was extended bed rest for our pregnant patients or surgical patients or cancer patients. And so addressing nutrition and movement and the neuromuscular system was a critical addition that I could contribute in training my other residents and colleagues. So I had that perspective, but then I went into private practice. And early on, in private practice, I had a patient who came in to see me, and this is, I remember, in late 1990s. She was 63 years old, had a history of ductal carcinoma in situ of the breast, and said, it hurts to have sex. She's dry. No doctor will give her hormones, and she loves her husband. She can't. It's too painful to have sex, and she's a woman of the 60s, and she'd rather die than live this way. Help me, Dr. Anna. And I was like, okay, let's look in my doctor's bag. What can I help this client, who is being treated as if she had breast cancer, but she had ductal carcinoma in situ. But even if she did have breast cancer, how can I help her? I mean, that's my job as a physician. It's not to say, oh, well, the case of do no harm means do nothing. That is not acceptable. So what could I do for this patient? And I was a researcher before I went to medical school, Genevieve. So I dug into the research, and with her, she was a president of a biotech company. She goes, found this information on testosterone, on other things we can do, vaginal estrogen, and let's look into it. I read all the research. I was like, okay, we can use DHEA, we can use testosterone, we can use vaginal estrogen. I mean, we look at these things and there's no contraindications. We want to stay away from progestins for sure. Well before the publication of the Women's Health Initiative study, we knew based on mechanism of action that Provera is not heart friendly, nor breast friendly. So we have that information from the HERS trial, which I participated as a scientific researcher in while I was a resident at Emory. So we have this information, it's just not mainstream. And so I started working with her, and then from there, other clients that, again, the considered the untouchables of medicine. That's such a terrible word, but it's so true. The women with breast cancer, other GYN cancers over a certain age, and they just been left to suffer. And that to me was completely unacceptable. And I started on this journey creating solutions, understanding, hormones are great, but it takes more than hormones to fix our hormones. Always address the underlying issues. When a patient comes in with a diagnosis, what caused that diagnosis? Great that you had it treated, but what caused it? And we had to do a hysterectomy. What was the reason for the hysterectomy? Did we address the underlying issues? So for me, this is truly my passion. And then again, the other untouchable area, Genevieve, is all sexual function. Vaginal health, bladder health, like talking about the urethra, talking about the clitoris, talking about the vagina, talking about the anus. I mean, red flags everywhere, banned on social media for having a conversation. 20 years ago, I think, I've learned to be much more careful. But just for talking the facts, it's so important to understand these issues, to address them, to make my patients feel comfortable and safe. Because when we fix these areas of their life, when we address the issues, my God, the world is technicolor again, like the background of your painting there.
Mm,
So
mhm. Okay,
beautiful. That's what we want.
thank you, for that comment there. But you have clearly been a long time champion for women, especially the women who are suffering from these issues. But I have to ask you, because you kept talking about getting to these root causes. So, what are the root causes that you see so often in your practice?
Yeah, and it comes down to three things, and I call these three things the devil's pitchfork. If we can address these three things, we're gonna, heal, reverse 99% of the diseases, the diagnoses that come up. And I always, want to punctuate that, whatever diagnosis you've been given, remember this: your diagnosis is not your destiny, right? That is just a label. And oh, don't even get me started on, the syndromes that we've labeled, all the syndromes that we Anyway, so we address the underlying issues, and when it comes down to it, if we can address these three underlying issues, the three issues, this will make all the difference. And for me, I like to make things simple for myself and for my patients. And so, what are the three issues? The one first, if we address the causes of inflammation in your body, there's no disease without inflammation. There's just none that exist in a, alkaline, non-inflamed body. Show me, prove me wrong. Well, if there is, it's less than 1% of them, and I don't know them. So inflammation. And the second is adrenal dysregulation. Adrenal dysregulation. So, what's happening is our foot on the pedal, the cortisol pedal, the adrenaline pedal, we firing up our system. That also contributes to inflammation. And with that, within this, this area, it's also number three is the hormone imbalance. So those three: adrenal inflammation, adrenal dysregulation, hormone imbalance. And with that hormone imbalance, I'm going to talk about insulin resistance, right? That issue as we get older, all our reproductive hormones decrease, but insulin and cortisol increase. So we have to become more insulin sensitive. We have to do that. We have to address our hormones, support our body's natural ability to make and use the hormones more efficiently, right? We need to do that. There's so many hormone disruptors. The answer is not piling on more hormones. Believe me, I am a hormone prescriber. I've done this for 30 years. I use bioidentical hormones. I've been a pioneer. Didn't stop during the Women's Health Initiative after that 2002 trial was published, because I read the research and I knew the research. I knew what I could do for my patients addressing these three areas and how important it is to balance hormones. So while I say that, it is really important to understand, to address the underlying issues, but empower our body to use and produce our hormones the most effectively, and cleanse our systems from the things that are disrupting our hormone receptors or our hormone production or our hormone mimickers, and pay attention to those things because that makes a huge difference.
Yeah, it's really fascinating to hear you talk right now as an OB-GYN, and I'm sitting here as my training is as a nutritional scientist, because what you're talking about is essentially what I studied, and what so many people have not made that connection is that I guess this is really how you got so interested in the ketogenic diet and supporting hormonal function through nutrition. And that's obviously been such a huge passion of yours. Could you talk a little bit more about, like, let's say I came into your office, and I clearly was suffering from, that triad, the devil's triad. What would you tell me to do from a dietary perspective?
Yeah, well, definitely, foundationally for me, I call it keto green. A way that we get into healthy ketosis, right? So it's more than, it's not butter and bacon keto diet. It is to get your body into ketosis in a healthy way while also focusing on the alkalinizers, the greens, the fiber, the low glycemic nutrients, polyphenol rich foods that we need to add to feed our gut microbiome. The most important population in the world that I want to protect is the microbiome, right? The healthy microbiome, the supportive, protective microbiome. We want to kill off the dysbiotic microbiome, but the good stuff. So like that's where the keto green, foundational nutrition, I call them, I created medicinal menus that help us get into ketosis and help us decrease inflammation, hence improve alkalinization in our bodies. And so that's foundational. So client comes in with whatever, it's always, okay, let's start you on my keto green 16-day keto green plan. Those are the easiest menus. Each has a healthy, high quality protein, good alkalinizing greens or phytonutrients, a healthy fat, and a fermented food. So that combination on your plate is so empowering and so helpful. So food is medicine, or it can be disease promoting.
Oh,
So we use
yes.
it here,
So,
right?
yeah, and I mean, listening to you, you were really very far ahead of the curve on this, because I think, first it was Atkins and promoting keto for so long, there wasn't this recognition of the need to support the microbiome and provide that fiber. So I have to ask, have you had to fight to get this information accepted?
Oh, absolutely. Absolutely. And someday, I mean, I've collected thousands of clients that have gone through and surveys pre and post my Magic Menopause program. At some point, I'm going to publish it, Genevieve. Like when I have time on my hand, we'll see. But, it's so empowering because, well, for me, it was being in my mid to late 40s, starting to hit that perimenopausal spiral. And even though my hormones were dialed in, I was like, okay, the 5, 10, 20 pound weight gain without doing anything different. Now, I'd been well over 240 pounds at one point, lost that weight, was able to keep it off, and then the weight started coming back on. And I knew I had to do something different. Not only was the weight coming back on, but the mood swings, the irritability, the monster within me, the intolerance, the burnout, the disconnect, all of these physiologic, the neuroendocrine changes during this vulnerable hormonal shift, even though, so there's so much more we need to understand about the female body. It's not just these macro hormones, let's call them. There's something else going on because my hormones were dialed in as a hormone specialist, but I'm still experiencing this weight gain without doing anything different, the brain fog, the mood swings, etc. So I had used the keto or low carb diets in my clinic before for my candida patients, for my patients with Parkinson's or seizures. And so I knew this would help. Plus, I had one of my daughters had seizures, started getting her seizures at a young age at 19. So I knew the ketogenic diet could help. So I'd been using that clinically in my practice as well. So I'm like, okay, but I felt not keto flu, but keto crazy. And I was like, okay, men can do keto differently than women. right? And no one had really studied it in women, let alone a menopausal woman. And so I started studying it and digging into the research and looking at the societies that eat a very ketogenic diet and thinking, okay, they've got to be missing something, because I had checked my urine pH, something I would tell my patients to do when I'm detoxing them, and it was as acidic as the paper read. So basically, I was peeing acid. And just think, as a gynecologist, acid in your bladder long term is going to create incontinence, interstitial cystitis, infections, urgency symptoms. Like, that is not good. No one talks about it. You can't keep that acidic urine in your bladder. It really needs to be more alkaline. And we know an alkaline urine pH is associated with lesser metabolic disease, diabetes, cancer. I mean, bone loss, all of that important stuff. So, anyway, when I realized I was peeing acid, I was like, okay, I need to add the alkalinizers back, right? Because, here I am in a full blown perimenopause, menopause at this point, and struggling to get the weight back off, because anyone who's lost a significant amount of weight and they start gaining it, they're like, oh my God, I'm going to be 300 pounds before this stops. I don't know. It was just, the weight gain without doing anything different. And so, I started looking at other countries that or other cultures. So you think of the Inuits and the keto tribes have long said, oh, well, look at these Alaskan Inuits. They're eating just, tons of fat all winter, the fish, etc. But they're not just doing that. They make fish bone broth. That's your minerals. That was such an aha moment for me. 'Cause I was like, they're getting the minerals back from the bones. Those are huge
Oh,
alkalinizers. Of
okay.
course they are. Of course they are. They figured it out. So I started adding more minerals. I started adding the microgreens, the alkalinizers, sautéing beet greens and kale soup and, like a lot of these, like researching traditional foods from different cultures. But the alkalinizers were key. And all of a sudden the weight released, and my mood lifted. I had this sense of peace, like the peace that surpasses all understanding talks about in the Bible. I experienced that. Nothing in my life had changed. Still had, single mom of all my kids, sole breadwinner, lots of stress, lots of trauma. But you know what? I felt that peace. And as a result of that, and I want other mamas to listen to this, as a result of that, my mornings went from, running everyone out the door, yelling, being late, stopping at Starbucks on the way because you're late anyway, dropping them off to 3 different schools, to all of a sudden the kids are coming down ready, giving me a kiss on the cheek, "Love you, mom," catching the bus. Unbelievable, I'm telling you, did nothing different but take care of myself. And again, choosing the food and the practices that increase that alkalinity, increase oxytocin, prayer practice, gratitude practice, realizing that not just what we eat, cortisol, you can be eating all that good vegan nutrition, but be stressed out and angry. And that cortisol is going to create that acidic urine that'll put you in a catabolic state, again, causing micro leaks in your cell walls, et cetera, right? We talk about leaky gut, et cetera. So cortisol does that. Cortisol is the key that unlocks the door to those intact cell membranes. Well, oxytocin does the opposite. So practice of gratitude, presence, joy, in prayer, meditation, those things, getting out in nature, practice that increase oxytocin, seal that gate
Mhm,
and create that alkaline urine pH. And so here you can, and the opposite's true. You can be eating pretty crappy, but be having fun, joyful, loving life. I would say eat crappy on that one meal occasion, but have so much fun, and you will be
mhm, mhm,
oxytocin rich and have that alkaline urine pH. And I will say, test me on this.
mhm.
Test your urine pH. You can get pH paper for pennies at the health food store. So, it really made a difference in my life. And so then I took this, and I called it my Magic Menopause program. I took the menus, I took the strategy that I followed. Okay, to focus on our sleep, focus on these aspects, and I took my most difficult patients through it, the stubborn ones, right, that I couldn't get the needle to move on, and every single one of them felt better within a few weeks. And so that became what's my Magic Menopause program. Back in 2014,
That
I
is
launched it.
incredible, and I love that you have that spirit connection in there, because that's been my personal experience too, that it's a triad of mind, body, spirit in terms of being healthy, and you can't have one without the others. And as I'm sitting here listening to you talk about this, I think it's so important for women to understand that your hormones can look fine, right? That's maybe your body piece, but other things can be going on in your body, and other things can be going on outside of your body and in your life on a much larger level. So aside from all of these interventions that you ultimately were the guinea pig for and you figured out, was I guess first question, was that really how you identified this devil's triad? It was that, or is there more to what's going on biochemically with the diet that is important to think about?
Yeah, so it really recognized the devil's triad beforehand. But
Okay.
now in that midlife, really adapting into the keto green and understanding that and figuring out, okay, why did, again, hormones were dialed in, nothing changed there, nothing else was changing. But I really focused on the alkalinity and getting into ketosis. That made a huge difference. And here, looking then in 2015, finally in 2015, a research article was published looking at MRIs of women's brains and looking at the or SPECT scans of women's brains and looking at glucose metabolism in the brain. And so they're saying, okay, well, glucose metabolism or gluconeogenesis in the brain is an estrogen dependent phenomenon. Really, it flows along the decline of the progesterone more so than estrogen, but progesterone's not studied at all in the female brain. So we know that estrogen um, supports gluconeogenesis. So during this time period when your hormones, progesterone and estrogen, are starting to decline, your brain's actually starving for fuel. It's not using glucose as much. So then
You forget your
you're
words.
right. You forget your words. You don't know why you went into a room. You feel like, okay, well, who was that again? I know I saw you. What's your name? All of that, again, a very, very challenging and concerning experience. But the use of ketones for fuel in the brain is not hormone dependent. So now I had shifted into ketosis and my memory was there, my clarity was there. I knew my kids' names. I mean, all that important stuff, right? And with the alkalinization in that healthy way, with really focusing on again, feeding the gut microbiome, addressing our physiology in a supportive, low inflammatory way, that's key. And so recognizing that helped me understand, first of all, that period 35 to 55, maybe 35 to 60, is a period of neuroendocrine vulnerability. But through lifestyle and nutrition, we can shift that so that we can optimize it. And I say be keto green, 80% of the time, right? Like 80% of the time. And then you can increase carbs periodically. But during this time period, when you're in that neuroendocrine vulnerability, you're experiencing all those hundreds of perimenopausal symptoms. You can nip that in. I've proven it as little as 10 days. 10 days, hot flashes can be gone. Okay.
Wow.
Because insulin resistance hot flashes are symptoms of insulin resistant, not just estrogen insufficiency. So all of a sudden, the women in my programs were like, "Oh, my hot flashes are gone." I'm like, "Well, I haven't prescribed you hormones. These are virtual clients, and they're like, their hot flashes are gone." So I dug into the research. So insulin resistance, continued and unrelenting hot flashes is a symptom of insulin resistance. So if you create that insulin sensitivity, wow, you've just improved their longevity, right? You've improved their longevity. So when I think of the devil's triad, I think of my mom's story, with cardiovascular disease and inflammation. I think I had to understand what happened from there, right? And then I keep that as a reference point as I create the programs. Like Keto Green decreases inflammation, supports the adrenals, right, and helps balance the hormones. So that's all part of the intervention, the therapy, the treatment.
I turned 50 this year, and I am definitely menopausal, and it hasn't been a super challenging experience for me so far. I need to knock on wood at this point. But I am very focused on my diet, and I'm very focused on my spiritual well-being and my overall health. And I have these ongoing kind of conversations with so many friends about hormones, because hormone replacement therapy, it seems like today there are many people who don't think that you can be well through this transition without replacing hormones. And I'm wondering what your take is on that.
Yeah, and I would say it always is you want to be in aligned with the patient's personal and preferences and practices as well. I will say, at this point, at least I will be on my balance cream and my Jolva cream till I die and my Mighty Maca. Like I will be addressing those issues till I die. Like that's important to me. And I don't know, probably be on some testosterone till I die. And I want to keep my bladder as healthy as possible. So the combination works great. And so there's so many aspects there. But I also have clients who chose not to. And so nutrition, lifestyle, nature are really important interventions for them. And when I walked the Camino de Santiago, one of the most amazing women I saw on the trail was in her late 70s. All these, smile lines, laugh lines, her body like that of a 20-year-old, right? Strong, agile, walking fast, and just like energetic, right? And she's not on hormones. She's not on hormones. And so you think of these things and in the blue zones, they're not on hormones and handfuls of supplements. They're not biohacking, biocharging themselves. And I honor that. I absolutely honor that. And I do think like, okay, if I was, again, hiking the Camino or, longer or living in the Amazon and waking up with sunrise and going to sleep with sunset and not exposed to EMFs and not burning like as much as I try not to, that, candle at both ends, so to speak, that, maybe I wouldn't need hormones or as much, right? And so that we get so much more from nature and sunshine than vitamin D. And I think that's the really important piece. And in the blue zones, not one of the factor were supplements or hormones. It was connection, all the oxytocin increasing practices. Again, the most powerful pharmacy in the world is the one in our body. So tapping into that's creating your blue zone. And that's what I have a online community I call the Girlfriend Doctor community. And like we are creating our own blue zone. One of our ladies, she's 79. I just got off the call with her with the club call, and she hiked. She was just out hiking for 5 days in the I don't know high mountains everywhere. She's quick, fast, 79 years old. She's mobile, and she told all of us as the key is keep moving,
Yeah.
keep challenging yourself. Right? Not that she's not on handfuls of hormones and supplements, but she is living life, and she's taking care of the cathedral of her body at the same time. She's out in nature, and that's her medicine. So, really, I think it's not a heck yes and a heck no. I think it is, uh, it has to be in alignment with our lifestyle, our choices, and how we resonate with that. And yeah,
No,
yeah,
I absolutely love that. And I think, you spoke to, well, you keep speaking to nature. And at French, obviously, we make supplements and we make red light therapy products. But
you
our
do.
philosophy has all right, but our philosophy has always been that is not about biohacking. It's not about kind of coming in with these super physiological doses and these really high intensities. Like with supplements, it's been, okay, what are we missing that we really can't get anymore from our diet, or that's really difficult? And can we get that from, make a food-based supplement, which I know you do that as well. With our red light therapy, it's, well, let's mimic the intensity of the sun so that we can hopefully bring in some of what people are missing simply from our interior focused lifestyles. But if you ask us ever, is it better for us to go out in the sun? Is this going to replace that? Absolutely not, right? We want you to do that. And so if we kind of look at that in the context of what you've been talking about with that doubles triad and menopause and this syndrome of menopause, right? The genital urinary syndrome of menopause, specifically, right? Those urinary sexual symptoms. How do you see non-pharmacological options, including light-based therapies, fitting into that?
I think it's essential. And this is where I talk about vulvar topical hormonal therapy, red light therapy, vaginal microbiome support therapy. All of this is critical to vaginal health and wellness. And I would say, in my practice, even my clients in their 80s, I have them using topical hormones in this area because incontinence, urgency, dryness, all of those issues make a difference. And it is critically essential and important. And not just red light. It's one of the reasons I recommend the fringe wand is it's red light with vibration, right? That helps with blood flow and vascularity. It works better in hormonally sensitive tissue, right? And that it's more flexible and more elastic and secreting your natural um, glandular secretions, right? So that we know, at least when I think about genital urinary syndrome and menopause syndrome,
Mhm.
another syndrome.
Yeah.
Really? Like, really? Like, we have to diagnose this? I mean, seriously? There's got to be a better way. But anyway, um, we want to support the entire vulvar vaginal health and red light. I mean, my clients love it. And I will tell you that I've this beautiful groups of patients that I've been seeing over the years. And when I recommended the vaginal red light and vibration therapy to them, they were like on board, right? They're on board because they understand how red light's affecting my skin in other areas. It's helping me with aging, it's helping with healing. I mean, it can be, it's collagen promoting. Like, let's add that in down there, right? So if we think of the stack, the healthy pelvic floor stack, that's definitely included in there. And I think that um, is definitely a non risk. Like, there's no risk. There's no negative risk, right? Are there any risks? I don't know of any.
Not
But
really.
one thing that I recognize is because ACOG put out a statement several years, maybe a few years ago now, that said, okay, these procedures, vaginal rejuvenation procedures, are fine in premenopause, but not the postmenopausal woman. But they didn't study it, right? They didn't say, well, what if we use hormone therapy? What if we support the vaginal microbiome? What if we do this ahead of the procedure, right? If you turn back the hands of time on that area, you're going to, those procedures will work better. So always say, want to do, it's yes and we want to do it together.
Mhm. Yeah, no,
And
I
I
agree.
ideally avoid the laser procedures, et cetera. With red light, we can do that now. I have a 74-year-old patient. I love telling you, I want to share this story because it's just so inspiring to me. So one of my patients, she's 74 years old. And I was asking her in the office, well, how's your sex life going? She goes, Dr. Anna, this last year, since we fixed things down there, it has been the best in our marriage. And 50 years married, 50 years married. And it's been the best. I said, whoa, 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 wait. Okay, like, tell me more. Like, what do you mean? What's going on? She goes, we love each other. We've had a good marriage. Sex was okay. But, over the years, was okay. It's something we did. We love each other. We care about each other. But since they fixed so using topic for me, I use Julva and adding the vaginal microbes. So the Lactobacillus crispatus supplementation and adding red light therapy, addressing the issues that are affecting her down there, increase the quality of her intimacy and relationship. And I was studying something recently because, for those of you binge watching any movies, have you seen Off Campus series
Mm-mm.
lately?
No.
Okay, so it's this college series. So my girls were watching it, so I'm watching it. They're like, "Mom, you got to watch this episode." And this college kids. She's had rape, and so she cannot be intimate, and she wants to be intimate. And he knows he has to establish trust for her in order for her to be intimate, right? And so I think that that is so true. As we age, if we have pain every time we do something, even though we love our partner, our body's no longer safe, doesn't trust the experience, and is going to prevent us from doing it, right? There'll be more, even more dryness. There'll be that lack of desire to initiate. And so creating that safety and trust by addressing those issues, like again, she was, again, my patient was dialed in with her hormones and stuff. She'd been in a functional medicine practice for decades. We started addressing the external vulvar-vaginal issues, game changing. And she said, not just in the bedroom with intimacy. She said, but in all areas of our life, we're laughing more together, having more, fun. And that's oxytocin,
Yeah.
right? So we incorporate it by just doing this. Like, it seems so trivial to so many people in so many ways and so critical to me. But it's like addressing the vulvar-vaginal issues, addressing clitoral atrophy, addressing vulvar-vaginal atrophy, the dryness, and we would call it genital urinary syndrome menopause instead of using the words atrophy, whatever, but that we address these issues and the body feels safer, has more pleasure, has more enjoyment. That's game changing. That's
Mhm.
like, for me, that's so important, and it's why, I champion vulvovaginal care and,
I love that. As we get kind of close to wrapping it up here, and I mean, I would love for you to get detailed with us about that pelvic stack. So you've mentioned the components of it, but can you tell us what that would, if you wrote this down on a prescription pad for a patient, what would it say? What would it look like?
number 1, orgasm. Let
Nice.
let's start there. I start clients on Julva. So I have my Julva product, which I created. I really started, compounding hormones with DHEA in it in the 1990s. So for that first patient, and then so this is Julva. It's plant stem cells, better than anything I can write on a prescription pad. Plant stem cells and DHEA in a very emollient, absorbent base. So typically tell clients start every other day for the first 1 to 2 weeks. And then daily, clitoris to anus, the vulvar labial tissue, and that naturally helps our bodies um, moisture. Velvet, which is my new lubricant, I'm sending you some. So the Velvet, it's aloe and hyaluronan, clean, water-based, propanediol, no propylene glycol, no parabens, nothing else in it. It's really clean, water-based lubricant. So that also naturally helps with moisture, but it's also a good lubricant during sex. It's also soothing with aloe in there because if postmenopausal vagina can be as slow and safe as possible, but you want to heal from those micro tears if you get any. You want to prevent it. Again, the hormone replenishment makes a difference. VB probiotic, so it's the vaginal targeted probiotic with the high quality strains. So that is key. And pelvic floor exercises, that would be number 4 or number 5 now. So the pelvic floor exercise, because muscle is magic and the most important muscles are in that pelvic floor. So we want to keep them strong and healthy. So that's critical. Then I would add red light and vibration.
Mhm.
So, and the reason I like your fringe wand over some others is that it's a narrower diameter. And you also have the blue light, which because for sometimes too, that cooling light, especially if there's, um, any inflammation or infections or postcoital tenderness, you can use that blue light and that can really cool things down. So,
Yeah, that's a perfect kind of combination. And I think with the frequency that you're recommending and how we recommend red light therapy, you don't need to do it every day. 3 times a week is sufficient. We generally recommend range of 3 to 5 times a week, but if you look at the research, there are benefits even as infrequently as using it once a week. It's quite remarkable. So um, it's important to not use an oil-based lubricant. So the vulva would be the oil-based, but then your Velvet is the new water-based lubricant, which is perfect to use with the red light therapy wand. And I mean, you can alternate days, right? So one day you can use the Jelva, and then the next day red light therapy with the Velvet. And what's the frequency for the microbiome support?
So initially, especially if you haven't been on any or in a while, I typically my postmenopausal women recognize that we need to be on it at least 3 months, so 2 capsules a day for 2 to 3 months. And then take a break, but it will be something you want to integrate back in. Because if we eat out once, we've just got another dose of antibiotics, right? If we're like,
That's
anyway, if we eat
disturbing.
non-organic food,
Yeah.
right, we've already got some pesticides, herbicides, and or antibiotic if, that's been injected into our animals or food sources. So you have to consider that. So periodically adding back the probiotic can make a really big difference. For my younger patients in their 20s, just doing one course, of the probiotic should be fine. If they have any vaginal issues, I'll keep them on it till we resolve it. That includes abnormal pap smears, bacterial vaginosis, and if I can culture, we'll do the vaginal cultures to confirm that it's seeded and then stop. And then just again, I think it's one of those things that like the seasons change, do a bottle, 2 capsules a day for, a month every quarter just for that preventative repopulating the healthy bacteria. Because as I've been doing vaginal cultures on clients in their 20s, 30s, 40s, certainly and beyond, I'm not seeing the healthy bacteria in there. I see a lot
Mhm.
of dysbiotic or just aseptic vaginas from all the antibiotic use and the hormone disruptors and the washes and, all that, really has affected the vaginal microbiome. Like, of course, it makes sense. Why wouldn't it have had? But we never addressed it. At least now we can test for it. And so adding in a vaginal microbiome, because I have patients too who've been on my Julva product for over 10 years, right? And then we add in the VB probiotic and they're like, "Oh my god, even better. Not getting up at all at night to pee," right? Like these are the changes I'm hearing from the community. I'm like, "Oh, it makes perfect sense." So
Mhm.
as I've been working with this more and more, the vaginal targeted probiotics, we had different lactobacillus species, but not the specific ones targeted for the urobiome and the vaginal microbiome. So incorporating this in has been really, really unbelievably beneficial. And I think it's like with the gut microbiome, it makes all the difference.
Mhm. And I really appreciate how comprehensive this toolkit is that you're describing, but it's also not onerous to do this, right? Like it's really manageable. And it is a very different message than what a lot of women are kind of getting today, which is we'll just go on hormone replacement therapy, use a vaginal estrogen and you're good to go. No, there's a lot more to the story than that, and perhaps that isn't the way that you want to go. If it is, of course, that's fine, but there are other approaches, and so thank you for all of this trailblazing work. I am
I wanna
grateful.
say I wanna say one more thing because,
Please
again,
do.
I practiced, using bioidentical hormones through the whole, time period that I didn't realize other physicians weren't trained in it even, right? So, estrogen works on the vaginal mucosa, and I'm very big about hormone disruptors. In every prescription vaginal estrogen, unless it's compounded, there are hormone disruptors in that. That gives them the shelf stability for years, right? Like you cannot, like my products, okay, maybe a 2-year shelf stability, but it's not a 10-year shelf stability. So like you've got it, like you look at those ingredients and that actually causes lysis of the cell membrane of like the cells, the mucosa, and disruption of the microbiome. I mean, so there's like a double-edged sword on those. Yes, estrogen can help the mucosa, but it's also not addressing, compared to DHEA or testosterone, it's not addressing the deeper layers. We know from using the studies, I've been following the work from Dr. Ferdinand Labrie out of McGill University in Toronto for 2 decades now. Over 2 decades, I've been following his work. And vaginal DHA increases the muscle walls, right? Strength of the muscles. And what I've seen with topical use and the improvement in the glandular secretion. So, with pelvic floor exercise, I always will say we do this with pelvic floor exercises, but we see that improvement. Same with prescribing vaginal DHEA and vaginal testosterone. It works in my clinical experience, I will say that, and according to the published research from Dr. Labrie, so much better than estrogen alone. So much better.
Thank you for sharing that, and I think that's something that I didn't know that, and I think that there are a lot of people who don't know that, and that's really important information, as is everything else that you've shared today. So amazing. We're grateful. And where can people find you if they want some more information?
So easy to find me at dranna.com, DRANNA.com. And on social media at The Girlfriend Doctor. Definitely encourage everyone to check out my YouTube channel. Lots of great information. Our interview is there. And again, I really try to pour out good information for clients. And also my books, The Hormone Fix, Keto-Green 16, and Menopause. All delicious, beautiful, and available anywhere books are sold. So, yeah, I
Amazing.
appreciate it.
Okay. Well, thank you so much. And thanks everyone for joining us today. And we'll look forward to seeing you again.